Hello all, thank you guys for joining us on Afia and Erin's Real Talk. Today, unfortunately, Afia couldn't join us, but we're going to continue on and she'll be with us next week. Today, we're going to be introducing Dr. Katharine Neill Harris. Katharine is the Alfred C. Glassell Fellow in Drug Policy at Rice University's Baker Institute for Public Policy. Her current research focuses on the availability of drug treatment for at-risk populations, the opioid epidemic, the legalization of medical and adult use cannabis. She supports policy reform that treats drug use as a public health issue, such as alternatives to incarceration for drug offenders, needle exchange programs, self-consumption sites, drug testing services, and much more. We'll be discussing the war on drugs and the impact that it's had on America over the last 40 years. Hi, Dr. Harris. Thank you so much for joining us today. We're so excited to have you.
Hi, Erin. Thank you. I'm excited to be here as well.
Perfect. So let's begin. For our audience who may not know about your background, can you please explain what drew you and continues to draw you to this work today?
Yes, so I've always I've gravitated towards issues, policy issues for a long time that relate to different forms of injustice. And that was something that's kind of driven me ever since I was in undergrad. And, I was originally going to pursue a degree in law, and I ended up instead going a public policy route. And when I was doing that, I kind of eventually had to sort of just pick an area to specialize in. And I just sort of kept coming back to criminal justice issues as one of these areas of just very glaring inequalities in our society. And then within criminal justice, drug policy just seeming to be sort of one of the most obvious ways that we could start reforming laws. And again, just one of these areas where not only is there the injustices of the policy, but they also just really don't make any sense. And so, I've just seen it as an area that's really needed attention. And I'm fortunate now, to be able to really focus exclusively on drug policy and all of the different areas that encompasses.
So as an introduction for our audience who may not know so much about the background on the war of drugs, for our audience who doesn't know that 4 decades ago, the US government declared it a war on drugs in 1971. Nixon identified it as public enemy number 1. How can you explain this history of this policy development for our listeners who might be less aware?
Yeah, so we can sort of pick different starting points for the war on drugs, but if we look at that modern starting point of the 1970s, what was happening then was in the 1960s, we had a cultural revolution, there was the Vietnam War, there was the civil rights movement, there was all of this cultural upheaval where there was a lot of a greater demand for more equality in society for disenfranchised groups. And that, the civil rights movement was a big part of that. And then what you had was sort of a backlash to that. And Nixon, when he was campaigning to be president and then as president, he really tried to capitalize on sort of the white resentment that existed, towards the civil rights movement. And the way that they did that was they really focused on tying this idea of rising violence and rising crime to, urban areas, and sort of making it a racialized issue where they say, that the civil rights movement is contributing to all of this violence. And then from there, drugs sort of became a part of that as well. They sort of folded that in. And as president, Nixon sort of pursued all drug offenses, but in particular, we have testimony from one of his former advisors that they pursued marijuana in part because they knew that it was a way, for them to criminalize, in their words, hippies and blacks in a way that they couldn't without pursuing that. So, it really kind of was less about, reducing drug use or drug addiction. It was a lot more about sort of pursuing more politically expedient goals that the administration had.
Got it. And that pretty much touches on my next question. My next question was going to ask about the drug hysteria of the 1980s after low cost like crack cocaine spread to lower income Black minority communities. And it kind of set the stage for an aggressive policing, zero tolerance policy. And if we look back in history, the temperance laws in the 1840s, they targeted Irish Americans, and the anti-opium laws in the 1890s with the Chinese, and then the new laws kind of targeted against cocaine and African-American communities in the 19th century. It is easy to see why so many people would believe that this was targeting people of color or minorities. Can you comment on that?
Yeah, absolutely. So, if you mentioned sort of if you go all the way back to the late 1800s and the early 1900s, it's really interesting to look at that history and sort of the roles that race played, and not just the domestic, considerations of race and, as you mentioned, sort of this anti-immigrant hostility toward Chinese immigrants, but also at that time, the United States at a foreign level, we were colonizing, we were sending missionaries to China, we colonized the Philippines in the late 1800s. And all of that sort of, it kind of tied into these moralistic American ideals of the need to sort of, for, in their words, civilize, native races. And so, that also tied in with the temperance movement, which was against alcohol use. And it was sort of this idea that, drug and alcohol use is immoral, deviant behavior. And, it's our duty, our Christian duty to stop that. And so that was one component of it, along with the idea then that, drug use was corrupting white people and white women in particular. There's a lot of rhetoric, about the idea that, drug use was going to, lead to the ravagings of white women. And so that is a lot of it. And then when you fast forward, sort of, going all the way back to the 1980s, that really was, Ronald Reagan, really played into sort of the cultural conservatism. And it wasn't, the rhetoric in the 1980s wasn't so clearly, about different races, but, there were a whole lot of dog whistles that we would recognize today about, crack use spreading from urban areas to the suburbs and that sort of thing. And then you also had just a whole lot of sensationalized reporting around it. If you look at the media coverage from the time, it was a wholly different tone than it is today on drugs. And there was a lot of sort of claims that really weren't based in any evidence, or a lot of things about, crack addicted babies, for example, was sort of this trope that was pulled out a lot that, really was damaging to, minority communities, minority families. And again, it was just sort of, politically expedient to sort of to support these kinds of policies.
Right. That is so interesting. So dating all the way back from the 1840s, like we were just saying, with Irish immigrants, 1890s, and with Chinese immigrants, then in the 19th century, all this targeting indirectly and very directly on African-American communities, the war on drugs was used as a government-led initiative to stop illegal drug use, as you've said. The movement started in the 70s, technically, or before really, but it still has a great impact today. Can you discuss how that affects us now?
Yeah, so it affects us in a whole lot of ways. If we're just looking at a domestic level, the war on drugs really sort of increased a certain kind of policing. So with the Nixon administration, they created a grant program for local law enforcement. And so now, local law enforcement gets a whole lot of funding from the federal government. Usually that funding is based on the volume of arrests. And that's something that you can see might easily incentivize drug arrests because, a drug arrest is fairly easy to make. There's drugs on a person, so there's evidence right there. And so, that's just one example, but, it sort of normalized this aggressive style of policing, and it provided justification. There's this claim that we need a drug-free America, and in pursuit of a drug-free America, we have to give the police all this power, all these weapons, tanks and these other kinds of things. We need to give them the power to stop people and search them on the street, all in pursuit of, saving our children from drugs. And, that even once it became clear that we weren't actually doing that, that drug use hasn't declined and that this wasn't really working, it sort of just normalized this type of policing to the point where now, especially in Black and brown communities, that is the norm for interactions that people have with the police. And so it's really just impacted the whole structure of policing and contributed to, kind of what a lot of people now see as this excessive use of force in general.
I'm glad that you opened that door up because that goes into the next section of what I'd like to talk about. So there has been more aggressive policing due to a lot of these policies, as you've mentioned. And as of 2016, 2.3 million people were incarcerated in the US at a rate of 698 people per every 100,000. The total US incarceration rate peaked in 2008 when the US had around almost 25% of the world's, 9.8 million prisoners. How does the legacy of the war on drugs impact this growing prison system through the arrests you were just talking about?
Yeah, so, the pursuit of drug offenses sort of, a lot of the things that police do are reactive, right? A lot of the times that police have encounters with citizens is because of a 911 call, right? And so then they're reacting to a scene. But with drug arrests, if you're a police officer that, you're specifically looking for drugs, then you're talking about a much more proactive kind of enforcement where you're creating encounters with citizens that might not happen otherwise. And each encounter that we talk about, between citizens and police has the potential to turn hostile or violent. In 2019, there were roughly 1.5 million drug arrests. For most of those were for possession, not for trafficking or anything like that. And again, those are all encounters that aren't necessarily harming public safety, but they are creating these interactions that we've seen now from all of these videos that are coming out that can turn hostile or violent. And so it's contributed to those encounters, to those violent encounters. And then in terms of mass incarceration, actually, if you look at mass incarceration with state and jails, prison or drug offenses, account for roughly 20% of the prison population. So it's not the bulk of people that are sitting in prison, but it is a significant chunk of that population. And it's also the pursuit of the drug offenses has really sort of widened the net of the criminal justice system, because what you have then is maybe somebody's not sitting in prison, but they're on parole or probation for a drug offense. So they're being monitored. And then, if they violate probation or parole, they might be sent back to prison. And so it creates all of these additional pathways for people to be involved in the criminal justice system. And so I think it's also important when we talk about mass incarceration to not just think about the people that are sitting in prison, but also the people that are cycling in through the jail every couple of days, and the people that are on probation or on parole. As well, because it really encompasses this much greater surveillance system that we have.
Right. That's exactly what I'd like to talk about. So today, Black males have a 29% chance of serving time in prison based on that at some point in their lives. Latino males have a 16% chance. White males have a 4% chance. Even though whites outnumber Blacks 5-1 in both groups of the use and sale of drugs, there's obviously disproportionate rate going on here. African Americans comprise 35% of those arrested for drug possession, 55% of those who are convicted for drug possession, 74% of those imprisoned for drug possession. And this skewed enforcement on drug laws has a devastating impact, like you were just mentioning, on the communities. 1 in 3 Black men between the ages of 20 and 29 are currently either on probation, parole, or prison. And like you said, it's not just the being in prison, it's the parole, it's the probation, it's life after that and how it affects them forever, jobs, etc. Can you comment on this vast, unproportionate difference in the communities?
Yeah, so there's the inequalities, between how Black and brown people are treated by the criminal justice system and how white people are treated happen at every single step. So the first encounter is the arrest, right? And we know that Black people are more likely to be arrested than white people for a variety of reasons. Part of it is where police are enforcing laws, where they're heavily concentrated. It's also a matter of, which, when we talk about traffic stops, for example, right? We know from the data that we have, and the data could be a lot better than it is, that, Black drivers are disproportionately likely to be searched. So there are all of these initial encounters at the point of arrest that make it more likely for Black people to be arrested for possession. And then from there, if you look at the next point in the system, if you look at bail and who's held pre-trial, right? Black people are likely to have higher amounts that they have to make for bail. They're less likely to be able to make bail. And if you are sitting in jail awaiting, either trial or determination of a guilty plea, or whatever the outcome is, you're far more likely to take the conviction or be convicted if you're sitting in jail pre-trial. And so that contributes then to why you see more Black and brown people, an even larger percentage of Black and brown people that are actually convicted and serving time for those offenses. And so again, we sort of see it at every step in this process, and it really does have a detrimental effect, not just on those individuals, but on their families. And, related to the issue of families, I think it's really important also to talk about women and the women that are incarcerated from the war on drugs. We focus a lot on the statistics on men because, men make up the vast majority of people that are arrested for all offenses. But if you look at drug offenses, women, the rate of incarceration for women has increased. There's been an 8-fold increase since the 1980. And a lot of that has been because of the war on drugs. Roughly a quarter of women that are serving time are there for drug offenses. And then you have another quarter of them that are there for property offenses. A lot of those property offenses are drug related. And so, I think it's always really important to include women in that conversation of the war on drugs and the impact it's had on them and their families, because we also know that, 60 to 80% of women that are incarcerated are also, they have a young child or a child that's a minor in the household.
Right. You recently wrote something that I read and I thought it was very poignant. I'd like to discuss it. You wrote, "The death of George Floyd has accelerated calls for police reform. Although decriminalizing drugs and the people who use them will not end police violence, it is part of the structural change needed to fix the problem." And obviously, as you were just saying, this goes to all minorities, women, African Americans, Latinos. But would you mind expanding on that for our listeners?
Yeah, so, we talked a little bit already about how, the war on drugs has normalized a very aggressive style of policing. And so, if you decriminalize drugs, right, and we talked about sort of all the encounters that the pursuit of drug arrest creates, right? So if you decriminalize drugs, then you remove the legal basis for those encounters, right? If police can no longer arrest people for drugs, they're much more likely to, pursue people for that reason. And so, I think that that's part of it. When we talk about, the sort of systemic racism that's within the criminal justice system, it goes much broader than drugs. I mean, if you look just, for example, at the system of misdemeanors, right? We often forget to talk about misdemeanors because they're these, they're minor offenses and, it's not a felony and, maybe the consequences aren't that bad or people aren't serving time in jail. But 13 million people roughly cycle through jails every year for misdemeanors. So it's a huge part of mass incarceration. And if you look at the numbers for the misdemeanors, you see the same rates of unequal enforcement for very petty kinds of crimes, public disorder crimes, public drunkenness, intoxication, and all of these other kinds of minor offenses. And so, with the war on drugs, I think that part of it when we talk about policing also is that, you have, unfortunately, and this does not go for all police, but you do have this mentality with a lot of police and with a lot of departments of this kind of us versus them. And I think, that is really, that cultural change is going to be really important to dealing with the structural issues that we have. And I think that dealing with the drug war is one piece of that, but then you also have to, you have to work on use of force policies. You have to work on training officers to handle situations that might turn physical, where they don't resort to deadly violence, as the first option. We need a whole lot of focus on health. We need a whole lot of responders to incidents rather than police. If you look at calls for service, a good at least third of them could be handled by people who aren't police in most jurisdictions. So that's why I say that there's a whole lot of other things that need to be changed, and the drug use issues are just, one piece of that.
Mm-hmm. Yeah, what an interesting way to think about that other people could be doing that kind of work instead of just having the police force do a lot of that. I hadn't considered that. But focusing on the drug policy reforms nonetheless, we are interested in that work that you've done because that is a big chunk of your background. Your research is focused on alternatives to incarceration for drug offenders, needle exchange programs, as I mentioned earlier. Can you explain why this research is so important and what it entails for listeners who may not know the significance of that?
Yeah, so we've focused for over a century now. Our response to drug use has been to prohibit it, right? And this idea that if we try to reduce the supply of drugs, that's going to deal with the problem, and it just hasn't. I mean, we drugs are available everywhere you go. There's literally no way to stop it, and the reason for that is because we haven't addressed the demand. Where there's a demand, someone will meet the supply. It's a basic economic principle that people learn in high school. So The fact that our policy is, it seems to try to ignore that basic fact is just, really nonsensical. But, one of the things that we try to talk about is the fact that, prohibition has not worked, right? And there's many ways to show that that's the case. And so we need to offer alternatives. And, the alternative model that we look at, you can call it a harm reduction approach. And it's sort of, we try to recognize that drug use is it's a fact of society. People are always going to use drugs. And so what we should be doing is developing policies to minimize the harms around that drug use and to ensure that people, have other options than using drug use as a way to cope with whatever the problems they're dealing with in their lives. And then also, if they choose to use drugs, to use them in a safer manner. And you mentioned the needle exchange programs, and that's a perfect example where, people can, rather than reusing needles or sharing needles, people can go to a place and get clean needles that they can use if they inject drugs. And that's important on so many levels. At an individual and a population level, it stops the spread of, hepatitis C and HIV, which, we don't want those things circulating in our communities. They're also very expensive to treat, if you're worried about the economic impact of it. Needle exchange programs are also, very inexpensive compared to treating people for life that have HIV or Hep C. And the other benefit of programs like that is that it puts people who use drugs in connection with healthcare workers, where otherwise they might not be getting that connection. And so it can provide an opportunity to help people, seek alternatives to drugs or to get into treatment. Because they say, well, maybe I'm not ready for it right now, but now I have this resource that I can go to and find out more if I decide that I want to stop using or reduce my use. And so it creates all of these pathways to getting assistance that right now, we don't have a lot of them. Our main way of getting people into treatment is through the criminal justice system, and it's really not effective. It's not an effective approach.
Right. So I'm sure you've heard this a million times. There's going to be listeners who hear this and they're going to say needle exchange programs. Why should we be, backing that kind of idea? It would just perpetuate this addiction. And I'm sure you've been met in this field with lots of resistance to these alternative options. How do you react to that? What do you say to these people that would kind of call you out on that sort of thing?
Yeah, so, it sort of depends on who we're talking to, right? So a lot of the times when it's members of the public, they tend to be a little more reasonable and they might not be familiar with these things, but if you talk to them about it, a lot of people can kind of see the point that, a needle exchange program it's not a program that enables drug use. There's absolutely no evidence that, having access to clean needles makes people decide that they want to shoot up heroin. That's just not how it works. It's really it's a public health intervention. And again, I try to remind people that, less people walking around with these diseases like Hep C and HIV is better for everyone. It's a public health benefit. It's a population level benefit. When you're dealing with elected officials, the calculations can be a little bit different. And sort of just depends on, needle exchange programs are something that can be determined at the state level, right? So, some states have these programs, some states are very supportive, some states are not. That often has to do with the politics surrounding the issue. We've usually had conservative states that are unwilling to allow them. Texas, where I live, is one of those states. And you have people in the legislature that support them and understand them, and you have other people that are simply not willing to listen. And they, even though public attitudes towards drug use have changed so drastically in the last few decades, even though we see that now a majority of Americans support providing treatment to people over incarcerating them for drug addiction, you still have in certain pockets this, conservative opposition to anything that might appear to, be soft on drugs or condoning drug use, even though, again, needle exchange programs don't do that. But that's the perception. And that's very difficult to deal with. And the only times that I've really seen that change, the best examples of that are in states like Indiana and Kentucky, where you've had conservative leadership there who's been traditionally opposed to things like needle exchange programs. And then, with the opioid epidemic, they'd seen HIV outbreaks in some of their communities. And once they saw that, they were much more willing to authorize needle exchange programs because the evidence is so strong that they work to prevent that. So unfortunately, sometimes it takes a kind of crisis like that really hits home for for some officials, for them to take it seriously and really actually start to listen to the evidence.
Right. And I'm listening to you and I'm wondering how much privatized prisons kind of play into that, or prisons for profit. That's become such a focal point for so many people in the last few years. Is it in the interest of these privatized prisons and those who benefit from it not to embrace alternative options like the ones you've expanded on here today?
Yeah, so the private prison conversation is an interesting one to have. It should be noted, I think, that it depends on the state, but roughly 9% of the incarcerated population in the country is in private prisons. So they don't hold the majority of people that are incarcerated. But a lot of the companies that own the private prisons also operate sort of related things, commissary, within jails and prisons, the use of phones, which, I mean, people in prison are charged an arm and a leg to use the phone to call people. And so they're all these sort of ancillary things in addition to just housing people that private prison companies are involved in. And I would say that they, I would say that they don't necessarily oppose something like needle exchange, but they generally oppose any sort of, reform of any kind of criminal justice laws that might result in fewer people in prison. So, I mean, I think that they can be an obstacle to reform. And I think it sort of depends, again, on the state that you're in and what role private prisons play in that particular state.
Right. So let's say that someone ends up in one of these prisons, privatized or not privatized, as you were saying, as it's only 9%. What options are there for those who may be battling addiction and end up in prison?
Unfortunately, that again depends sort of on where you live, right? We've seen states like Vermont, implemented sort of a pioneering program where if you're in prison in Vermont and you're there for an opioid use disorder, you have all 3 medication-assisted treatments available to you. Medication-assisted treatment being the, sort of gold standard for treating opioid use. In other prisons, maybe you have access to one. Usually, the bulk of people don't have access to any. And maybe you have some access to sort of some like group therapy classes. Maybe you're required to take group therapy classes. I know here in Texas, actually, we've had sort of this backup of people that are scheduled for release from the state prison system, but they can't be released yet because they haven't completed the classes that they're supposed to take while in prison, because there's a really long waiting list for those classes. And it just seems, again, sort of nonsensical to hold people because they haven't taken these classes that they could be, getting that help in the community. So, there are some notable exceptions, like I said, Vermont, and there's some of the other states in the Northeast. And I believe West Virginia and Kentucky are also working on getting more access to treatment for people that are in their prisons. But, in the prison system in general, the treatment is really lacking. And in jails, you have jails that are working to provide treatment as well. But part of the challenge with jails is that a lot of times people aren't there for that long. Maybe they're only there for 2 weeks or 3 weeks, and so it takes a while sort of to get people the services that they need while they're in there. And then by the time you get them set up, then it's time for them to go. So again, it's not really an effective way to deal with it. And we talk about rehabilitation, but that system provides virtually none as far as addiction goes.
Mm-hmm. Yeah, and considering what you were just saying about states like Vermont, Kentucky, et cetera, and seeing that there might be some reform in those states, I'm going to switch gears and then ask about the future of drug policy. Where do you see your work heading in the future, and where do you see the future of drug policy in a more general way?
I think that, I think for a while, we're going to be continuing to have the same conversation that we're having now. I think that it does take a while for these changes to happen. I'm really encouraged by the vote that we saw in Oregon in November, where the voters there supported an initiative to decriminalize possession of all drugs for personal use. And, I thought that was really encouraging. And I expect that, I think that, the groups that worked on that Drug Policy Alliance was, a major group behind that, for example. I think that the groups that worked to successfully get that initiative passed in Oregon, I don't think that they're going to stop at Oregon. I think that they're going to try to get other states to follow that lead. And so I think what you might start to see is hopefully that, we'll see decriminalization initiatives take the path that we've seen with marijuana reform, where, the West Coast states start to do that, and then maybe you start to see some states on the Northeast coast. Though with decriminalization of other drugs, it might take a little bit longer. And I also think certainly that you have states and cities that are going to be watching Oregon very closely and looking at, what data come from there in terms of what the effects of that policy are. But we talk about states and their reform. I think it's important to note that there are a lot of cities that are also paying attention. Cities, like Philadelphia or Baltimore, or Washington, D.C., where the leadership wants to follow the demands of the public to focus on these reforms, and they don't necessarily want to have to wait for the legislative process to go forward with those things. So I think I think we're going to see that continue to take place. And then I think in other states, I just think it's going to take longer, and that we're going to continue to have these discussions. As I mentioned, I'm in Texas. We'll be talking about this for a while.
Right. Florida.
Guys are ahead.
So we were talking about the future of drug policy, which you were just commenting on. And another aspect of that I think that we need to take into consideration is how COVID-19 is going to affect a lot of that. You recently entitled an article that you had written called "Why COVID-19 Will Challenge a Major Model of Addiction," in which you address the collective trauma of the COVID-19 pandemic and how it offers a clearer understanding of why people use drugs, as you wrote. Can you explain that or expand on that more for us?
Yes. So, I think one of the things about drug use and addiction, and I think this has been the problem in the past, is that people don't understand it if it hasn't been close to them. For example, with marijuana, with support for marijuana, we've seen the public support for marijuana reform, just trend up so drastically in the last few decades. And it's partly because more people have tried it. 50% of the population has now tried it in their lifetime. And so they try and they say, okay, this isn't so bad. It's not turning me into a monster. So, legalization maybe makes sense. And I think, again, with the opioid epidemic, we saw the same thing, that we've seen so much more compassion for people, who've been addicted to prescription opioids, because so many people have been prescribed, prescribed opioids for something, for a surgery, or, you got your wisdom teeth taken out. And so they think, okay, I've tried those drugs, and it provides them with some sort of, empathy for people that are going through it. I think with COVID-19, we're going to be looking at the impacts of COVID-19 in all areas of life for, decades. This is going to, produce so much research in so many areas. I think, as far as the drug use component of it goes, is that, people are having, some people are having a really hard time dealing with this, not just the loss of job, but the, the social isolation, the loneliness, the uncertainty. All of these are things that are perfect fodder for somebody to, want to alter their state of mind, and drugs being one way of doing that. We don't know so far how COVID-19 has affected drug use. We know in some areas anyway, it's increased people's drinking. We've seen overdoses increase as a result of COVID-19, although that might be a little bit more due to sort of people using alone and not having someone to, to revive them if they overdose, or also the fact that, more traditional, sort of treatment outlets that we had talked about, certain social services are not in existence or not fully operational. So there are a lot of different things that go into that. But, I think that COVID-19 provides us with this opportunity to understand the role that environmental factors play in addiction, that it's not just, a factor of, it's not just about like your brain chemistry and how your brain is wired, and it's not just an issue of personal responsibility. It's a combination of many different factors, and environmental stressors are a huge part of that. And this is an environmental stressor that we're all experiencing together. And I would add, I've seen so many conversations in the media about mental health and dealing with your mental health during COVID-19. And I'm so happy to see all of those conversations. I often don't see drug use included in those conversations unless it's included in this way that, you have some sort of full-blown addiction. And I think that it would be a benefit to people if we could talk more frankly about drug and alcohol use, in a way that recognizes that it might be something that people do as a coping mechanism, and there's a way to do it in moderation, you know, and find that relief and find that kind of, you know, happiness that you're seeking, but not, you know, fall into a pattern of dependency and addiction.
Mm-hmm. Exactly. So what should, other than the, you know, last few sentences you were just touching upon this subject, what should people do if they do have a loved one suffering with addiction during this crazy time with COVID, especially with the holidays coming up? It's a difficult time for so many people. What would you recommend?
It is a difficult time. And, you know, when you see someone that you love that's struggling with addiction, it can be really difficult to know how to deal with them. You know, unfortunately, there are limits on what, you know, you can do to have another person seek help for their issue. And, you know, I know that, you know, from my own experience with friends that I've had that have dealt with this. And, you know, I think that the best thing that you can do are, you know, be there for them, talk to them, let them feel like they can come to you and talk about the issues that they're struggling with without you necessarily saying like, you have to go get help right now. But at the same time, what you can also do is you can do some of your own research on services that are available where they live, you know, and then you can make a list for them of treatment providers that they could go and see, and you could say, hey, you know, I have this information for you that I have found that if you would like to seek treatment, here are some alternatives, here's some possibilities for you. You don't have to do anything with the information, but it's there. And I think that can be really helpful, because I think that sometimes when people are seeking help for these issues, they don't know where to look. When they're like in that moment when they think I really need help, they don't know exactly what to do. They don't know, you know, what the next step should be. And it seems sort of overwhelming, you know, to try to figure out where to seek help. And so I think doing a little bit of that legwork for them, I think can be really helpful.
No, that's great information, actually. I appreciate that. Thank you. And that is actually the conclusion of our interview today with Dr. Harris. Dr. Harris, thank you so much for taking the time to speak to us. This has been a thoroughly interesting podcast. Thank you.
Thank you, Erin. Thank you for having me. I've enjoyed it as well.
Thank you.